Nice. Thank you, Lisa. Well, Medicare open enrollment kicks off next month, so you'll soon see a lot of those advertisements for Medicare supplements. There are a lot of options out there. Sometimes this gets kind of confusing. What's covered, what's not under the original Medicare? What are all those parts anyway? Well, here to help us kind of navigate through this, we have our AAA expert, Skylar McKinley, with us today. Let's just start with the basics here. What is Medicare and who does it cover?
So Medicare is a government-run health insurance program for Americans who are 65 and older and people with certain disabilities. What's confusing is while it is a single program, there's a lot of different parts. And the reason there's so many parts is so that you can kind of customize your coverage based off your needs.
Yeah, let's talk about the different types that are out there. And it's depending on, again, what kind of needs you have.
Yeah, it's alphabet soup. So you'll hear a lot about Parts A and B. That's original Medicare. That's covering your doctor's visits, your hospital inpatient stays, that sort of things. But you might have needs above and beyond that. So Medicare Part D, for example, that's prescription drug coverage. You can add that to Parts A and B. Or you can get from one of these private companies a Medicaid supplement plan, right? And that kind of fills the gap. That's what they call Medigap coverage. Finally, you have Part C, and Part C is kind of separate from Parts A and B with more comprehensive coverage, usually including vision and dental and that sort of thing. So yeah, there's a lot of options out there.
So this is why we're going over this today. So there's original Medicare. You can add on or add these supplements to it. Can you opt out of certain things like C, or would you want that? It just depends on your situation.
Exactly. So you're only really going to be seeing ads on television for Part C and the supplements, right? Okay. So if you have A and B, you're going to want a supplement plan to fill those needs unless A and B do the trick. Or if you want Part C or Medicare Advantage, I think it's called.
Right.
That's this complex and more comprehensive coverage. At the end of the day, though, if you're above 65, remember, enroll now for Parts A and B starting about October 15th.
Okay, so about a month away.
It's confusing, right?
It is kind of confusing, yeah, but it's very helpful to get people through some medical situations. All right, Skylar, thank you.
Thanks.
Nicole?